Hi, this is Dr. Jaitly. Welcome to the sections of Basics and Fundamentals in Cardiology, the study of the heart. In this pertinent section, I'll be talking to you very briefly about what blood pressure is and why do we need a pressure and how is it measured. So blood pressure is the amount of pressure that's required for the blood to flow and maintain a reasonable stream of flow throughout the body as well as throughout the heart and the chambers. Why do we need it? We need that in order to have a reasonable amount of pressure within the system to deliver oxygen and nutrients to every nook and corner of your body. It is measured in two parts. One's the systolic phase, which is the contractile phase or the peak phase, and the other is a diastolic phase, which is the relaxation phase or the trough phase. Because the pressure travels in waves, because as the ventricle is contracting, it gives a stronger wave, and as the ventricle is relaxing, it gives a trough phase or the lower phase, which is called the relaxation phase. So the pressures will fluctuate during the course of each cardiac cycle, but it's measured either at the peak or it's measured at the trough. So we have a peak reading and we have a trough reading. Therefore, two readings are important to be measured when you're measuring blood pressure. It's commonly measured in the arms using a cuff and a gaze to read both the systolic and the diastolic phases or numbers, and it's measured in millimeters of mercury. For example, if your doctor tells you your pressure is 120/80, which is considered normal, a systolic is the 120 and the diastolic is 80, and that is considered as the peak and the trough. In other words, the heart contracts and sends the blood to the peak pressure of 120, which is very normal for the vessels at the receiving end. And when the heart begins to relax, the pressure goes down but never comes to zero. It comes down and the pressure is about 80 during the relaxation phase. So in other words, you have measured pressures both in systolic and diastolic, and the numbers are represented the following way, 120/80 respectively. Hope you understand the significance of the pressure. It's very common question, and obviously it's very analogous to your working system in the house. For instance, you walk into the kitchen or your bathroom, you turn the faucet open. There is a reasonable amount of pressure in order to have the glass filled with water. Otherwise, no water is flowing. So you have to have a pressure through that faucet in order to maintain a flow throughout the house. And that's what we're talking about, a blood pressure where a flow is maintained through your arteries and veins in such a wonderful fashion that the heart keeps the cardiac cycle and the phases between systole and diastole working. So the flow is in a sinusoidal fashion or a pulse-style fashion as it travels through miles and miles of arteries and veins as branches. I thank you for your attention. Again, this is another fascinating aspect of the cardiology or the study of the heart. And please stand by for more as it's coming around in the next few videos. Thank you.